We'll start with the Pledge of Allegiance. We'll stand up and face the flag. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So welcome everyone to the March 16th Board of Health meeting. I think I sent the emails to everyone with the revised minutes. Thank you, students, for providing that for me. It seems like this is going to be a good pattern to work where you can just send it to me and I'll send them out in a revised version. If anybody has a motion to approve the meeting minutes from the February meeting. Is there a second of the five of us?
I second.
There is. And and we'll vote on that. Is there yays for approving the minutes?
Yay.
No nays? Minutes are approved from the last meeting. Thank you. Let's go to the health officer's report, please, Larry.
Good evening, everyone. First, I'd like to take the opportunity to welcome all our guests tonight to our March 2015 Board of Health meeting. In your packet, you'll find my report for inspections regarding food safety inspections, bathing places, and meetings, and those type of things. In addition to that, I wanted to bring your attention to the Radnor Township Health and Safety Fair, which will be Wednesday of this week from 10 a.m. to 2 p.m. Vendors can come in at 8 o'clock in the morning and start setting up. Also, I just want to let you know that we were trying to get Delaware County Intercommunity Health, who have agreed and now will be here during that, for this health and safety fair. I wanted to also bring your attention to, bear with me a minute, on March the 30th, for those food establishments that throughout the township that do not have a certified food safety professional as required by state law, we're having a class here at the township in this very room. I'm bringing in a trainer, JB Legacy LLC. Give me a call, 610-688-5600, extension 148, and I can provide you with that information. This information is also on our website so that you can get and maintain your certification as required. Also, I want to bring your attention to some free dental care. I think I mentioned it last month from PCCY. You call the number of 215-563-5848, extension 32, and set up an appointment for a dentist in Upper Darby or West Philadelphia. I'm sorry we don't have one that's closer, but for free dental care, I think we can, travel a little bit for kids who need dental care. On Friday of last week, we hosted the Delaware County Local Boards of Health meeting here in the township. We had Judy Miller, supervisor from Pennsylvania Department of Agriculture, come out and update us on the changes in the food code. Other than that, I think there was pretty much the routine inspections in my report, and so ends my report, Mr. Chairman. Any questions?
Thanks very much, Larry. I just want to clarify one thing, Larry. For the township residents, is it correct that they can still find all food inspections online on the Radnor Township website?
That is correct. And one of the things that's going to be a new requirement in the new food code is, and that's going to begin after May 1st of this year, food establishments will then be required to, in addition to me putting them online, post it in their restaurant, that inspection report, so that patrons, when they come into the food facility, can see what the latest inspection report is for that facility, and it should be posted in the restaurant. So, yes.
Thanks very much. Yeah, I was in New York City this weekend and noticed all of the restaurants and businesses with food with a letter in their window in the front, and found it very interesting as you walk around and see mostly A's, I think, because of that very idea that they have to be posted in the window.
I can tell you this, that since we started putting these online, my inspections have become better.
I would imagine. So thank you very much, Larry. Appreciate your report, Mr. Tautone. We'll move into some old business. The student project ideas for 2015, I believe Dr. Leader was working with you folks about what to do. Has there been any updates, or have you guys settled in on your ideas for the season?
Yeah, Mrs. Shannon and I have been working together, and things are going well. We've been talking about Donate Life, so the progress is being made.
As for the education of the public about the chemicals, the newsletter, I will be able to write in it, except it will only be in time for the Household Hazardous Waste program in June, so I can spread the word some other way for the one in April.
Thank you very much. We appreciate it. Let's go to, we're going to jump around a little bit on the old business so we can get to some things here. Discussion about smoke-free areas in Wayne. I was taking that on, and there is a Wayne Business Association meeting this Thursday, and I will try to, again, to attend that in the morning. It is 7:30 in the Township building, I believe, and I will, again, speak to some business owners in the area about the feasibility of street dining areas being smoke-free and their thoughts on that, and then we can come back to the board and discuss that as a board. I tried in the spring as well to speak to some of the business owners in the township about ideas for smoke-free areas of Wayne for dining outside, as well as it's already smoke-free inside, as we know. So hopefully we can continue that conversation and make some decisions about a recommendation from the Board of Health. Dr. Humphrey, who is not in attendance tonight, had emailed most of us, I hope, a proposal for what we discussed as trying to come up with a mission statement for the Board of Health and sort of what our role is in the community and what our role is with the Board of Commissioners to help make healthy decisions for our community. I think that it needs a lot of input from the other board members, and over this next month, I hope that we can kind of continue on this path. Dr. Humphrey sounds like he sort of got some words together and put some things together and put a nice paragraph together, and I think we have to kind of incorporate other boards of health's sort of mission statements in this. So as the month goes on, I think I'd like to speak with people about getting this a little bit more concrete.
Regarding the mission statement, Mr. Tautone, is it possible for you, with all your connections with counties, townships, et cetera, to gather us Board of Health mission statements from them so we could why reinvent the wheel, take the best and make it ideas from those?
I can take a look around and make some calls. I don't want to spend a whole lot of time on it.
No, I just thought with whatever your connections were that you would send an email and they'd send it back. That's simple. That's what I'm thinking.
I can reach out.
Thank you.
So hopefully we can get to, just to start putting this together over the next couple of meetings and have something in writing and concrete soon. And then before we get into this, what one of the residents had brought up last week about outdoor dining with pets, we'll also just let people know that we are, as a Board of Health, trying to keep our eye out on what's going on with Bryn Mawr Hospital and changes that are occurring within the Mainline Health system. And I will try to reach out to Bryn Mawr Hospital and Mainline Health's people to speak with us again at some point prior to our season of Board of Health meetings being over. So sometime in the late spring, I'm hoping to have back maybe Andrea from, is it Gilbert from the Mainline Health System to come back and give us an update on their plans for Bryn Mawr Hospital. So then we'll move into one of our residents last week had it brought up in the meeting about outdoor dining with pets and his desire to have a nice dinner outside in Wayne with his dog by his feet. Of course, as the Board of Health and as a pet owner, I think that we would all like that. However, I think there's some obstacles to that. Can I ask Dr. Capuzzi to give us a little bit of an update on some of that information?
Yeah, the Pennsylvania Department of Agriculture. There we go. Pennsylvania Department of Agriculture sets the rules, and the municipalities have to either comply with those rules or exceed them. So they can't, but they have to, at the very minimum, enforce those rules. So the township cannot allow, and the rules state that no animal can be on the restaurant premises. A restaurant premises is defined as any area where wait staff or tableware, that utensils, dishes that are returned to the kitchen go, for the purpose of potential cross-contamination of food in the kitchen. And the only exception is service animals, therapy dogs, military animals, any kind of service animals. As far as service animals, it only includes dogs, and there's a separate section for miniature horses. So,
Interesting. And I think that it seemed to be, as we communicated through the month, that there really isn't any flexibility in this, in the state regulations, and it's not something that the township can make a decision on its own. So I think it's important for us to understand that the public's, wishes are to do a certain thing, but there's certain restrictions that certainly apply in this situation. And I believe another email came through from the same gentleman who brought this up last meeting. Would there be a way to do this with a takeout type of model where paperware is used and nothing else is returned to the kitchen, but it does not seem to be feasible because wait staff would still be having to come outside and return to the kitchen again, so it doesn't seem like that would be feasible either.
it seems like that wouldn't be feasible, although in the case of, I know there's at least one cafe in Wayne that has tables outside. I would think that that they would be meeting the restrictions if they got a muffin and coffee and brought it out to the table outside. As far as service of the tables, if those tables are cleaned as a regular course of business during the day, then that is not considered something that can be done, that they can't eat there. But if they're cleaned on occasion, and not like, after every person leaves, then it's a different story. Then it is considered, takeout and disposable. But if the tables are cleaned and cleared by people who work in the kitchen after every person who eats at the tables outside, then no, to my understanding.
And I believe that's sort of the gist of what he was looking for, was into that area in Wayne where we all can sit down, eat, and be served by the fine restaurants in Wayne. So I think that settles the question, if can this be done? And I think the answer is no, although it seems like such an easy idea and such a great idea as pet owners and community residents here in Radnor Township. So we shall move on.
Dr. Foreman, I would suggest we recommend to these folks that they write their state representatives. If things are changing, times are changing.
Absolutely.
Then maybe the state law needs to be revisited, the state code.
Absolutely. So we will move from there. Okay. Any other old business that anybody had comments on? Nothing? Okay, from last time. All right. So we'll move on to new business, and I'll just give a brief update from the last meeting. We had the same township resident had also asked about measles, and I'll also give an update about flu. So the discussion in February about measles, as there was a little bit of media coverage concerning measles outbreak in the West. There was a question about how does our township do compared to other townships as far as coverage for vaccinations. And although I don't have specific township numbers or school district numbers, I do have Delaware County's numbers, which is interesting because Delaware County actually leads the state in coverage for vaccination. we have about a 99.9% coverage of 7th graders with 2 MMR vaccines, and about 87.5% of kindergartners with their 2 MMR vaccines. As you may or might not know, there are 2 required measles, mumps, rubella vaccines for children, and the second dose can be given anywhere between 4 and 6 years of age. I'm assuming the rate goes up much greater by 7th grade because some of the kindergartners are in the 5-year-old range and have not gotten their second measles, mumps, rubella vaccine as of that time. Compared to state numbers, the averages are about 95% for 7th graders and about 86% for kindergartners. So it's a small advantage we have here in Delaware County. But there is a good uptake of vaccination in this community, well above the threshold that is often noted by the Centers for Disease Control for herd immunity, which would cover people who were not vaccinated because the vaccine protects enough people that the virus is not transmitted through a community as easily. So I think that's good news for our township. I think that's good news for our parents. And it makes us feel more secure as a township that we're doing a good job with health care coverage and keeping people healthy. I'll also update everybody on the flu activity. As you may know, the flu was a fairly bad season for flu, probably as bad as it's been since 2005. Between mid-November and February 21st, there was an increasing peak of the number of cases from about 12% of specimens that were testing positive to about 31% at its peak. So anybody who came into a healthcare facility and got their nose swabbed, about 31% were testing positive for flu in the peak of the season, which is fairly high. It's declined since February 21st significantly. Influenza H3N2, which is the influenza A strain that's been predominant in the community, has not been covered in the vaccine because of its mutation since the vaccine was introduced back in August or September. So most cases of flu this year were not covered by the flu vaccine. However, there is some evidence to show us that getting a flu vaccine yearly may give you some extra protection even when the strain is not covered. So I want to emphasize that even if a flu vaccine isn't good one season, it's still important to get the vaccine because every time you get a flu vaccine, you probably get some more immunity to different strains of vaccines, of flu that can occur at any season. Antiviral medications are still effective against the vast majority of flu strains this year, which is also good news that if you get health care quickly for the flu, there is still an available medicine, although not perfect, that may help you get better. Totals for this season included 14,000 plus hospitalizations and unfortunately 104 pediatric deaths this year. The numbers on adults are a little bit unclear considering many people who have flu also have other reasons to be ill and expire from some of those in addition to getting the flu. So always important to get our flu vaccines, although this season I think we're wrapping up the flu season. Okay, so thus ends the flu and measles update for this year. We'll move on to a couple of other new business things that I was thinking of over this month. One, I think is rather obvious that we have a number of potholes in the community, and I think the township is responding nicely by putting up a sign that I saw in front of the township building to report potholes. Was there a phone number that people would call if there's a dangerous-looking pothole in the community?
610-688-5600, extension 155.
Thank you. The reason I brought that up in the Board of Health meeting is I feel like when I'm driving my daughter to school in the morning, when it's very trafficy in the morning around school time, it feels like people are really playing obstacle course on the roads rather than driving because they're trying to avoid losing their suspension.
Mr. Chair, if I could add, we do try to address these, but State Route 30, Lancaster Avenue, Sproul Road, Bryn Mawr Avenue, Conestoga Road, those are all state roads. And although you can call into the township, we will report that to PennDOT. We've already reported them to PennDOT, but we will continue to do so. And in real severe cases, the Township Public Works crew will go out and fill some of them.
Thank you so much, Mr. Nursini. I appreciate that. hopefully keep us from having more problems this winter season, which is almost over, I promise. The Board of Health is declaring spring on March 20th. I'd like to also discuss, for the next few months, we're trying to, as the Board of Health, to try to give some time for the community to get some education about certain health matters in the community. I have a preliminary schedule done, and I've been communicating with board members about when they'll do a little presentation. So I will welcome Ms. Shaney next month to be giving a presentation about the gift of life. Thank you. And we'll also have in the future some more interesting information for everybody in the community. Hopefully you'll stay tuned. Okay. And then last, we'll move into an issue that was brought up last year, but I think we have to start to bring it up again. And we've been getting some feedback from the community concerning herbicide use. So last year in the Board of Health, we made a recommendation to the Board of Commissioners that, and Mr. Nagel has told me in the past that it's been taken up as we're trying our best as a community to use natural alternatives to fight off weeds and blight in the public grounds, and if at all possible to use those, and if not possible, or if it seems like that's resistant to natural ways, that we would use a limited amount of glyphosate, which was the only chemical that we discussed last season as the Board of Health. So what I'm concerned about, I think, is that I've heard from the community before this meeting and at the end of last meeting that there are other chemicals being used on some public lands that we haven't looked at, and I don't know if the Board of Commissioners is aware that I think it's a farmer who's renting the land, maybe using these chemicals?
Using quarry field.
Okay, so
He's not renting.
he's using the quarry field and applying chemicals that may or may not be either approved or have been looked at by the township or the boards. So I just didn't know if there was any further information that you folks have about that from the Board of Commissioners or Mr. Norsini.
I'd like to address something here. There is a licensing agreement with the farmer. If you remember the whole discussion of the purchase of Ardrossan, one of the things we talked about was having the farmer stay on the land and maintain the land for the township for a duration. And the idea is the license agreement is seen to be very short-term, probably no more than 3 years, during which time we work out some of these issues. Plus, there's other things we're doing. As you know, we had a $1 million grant to do some work down past Sawmill Park on those fields, reforestation and ways to keep the cows out of the stream, for example. When this came to a vote, I had proposed language that required that only organic materials would be used. In fact, Sarah stood up at that time and asked that those words be changed to say best practices. Our goal is to only use organics, just like you've heard for all our other parks. But you can't ask the farmer to tomorrow stop using. It's his way of life. He's what he's used to, and he is following the practices that a lot of us don't like, but it's a common practice with farmers, which is to use GMO products that are bred to be resistant to Roundup, and then use Roundup for weed control. It's completely our goal to get out of that mode, but it's going to take some time.
Well, my question is, many of us have to do things we don't like. So if he doesn't like that, I'm sorry that he's used to doing it a certain way, but if it's healthier for this township and he's within this township, then I would think that's where the Board of Commissioners and Township Manager, Mr. Norsini, et cetera, come in and say, it's time to change.
Well, we are working towards that. However, recognize, and even this board found that there's no strong scientific evidence supporting the claimed dangers of Roundup. I mean, I sent to you folks several publications that came out in the past few years and asked that they be reviewed. We did the same with the EAC. So it's not like this is being ignored. But again, the goal is to get out, to use organic processes. And Steve will talk to you about some of the things we're going to do in other parks with this.
I think also, just real quickly, it just came to my attention today that there are other chemicals other than the glyphosate, which we did review last year. That's the only reason I brought it up, because I hadn't heard of these before. And, it will honestly would take some time to research and look at these products as well. I don't know a whole lot about them. I'm a pediatrician, not a chemical engineer. But I think it's worth the time, at least my time, because I did this last time, to just look at some of these chemicals and hopefully report back to the public and about what they are. We will, go from there. But I do appreciate your input, Mr. Nagel, and I'll take it upon myself at some point between the next meeting to kind of look through these and be more specific at our next meeting about some of these things, and we can discuss it further.
One thing, if we can, is Steve's got some information for you. As part of the Board of Health, I know last year you'd looked at this particular topic, and I know the Board of Commissioners over the last several years had looked at what the fertilization program is, which Steve will talk to you about, and the organic materials that are being used and what we don't use. So I think it's good for Steve to review those, as well as, I know some of the commentary that has been had here of the move away from the Roundup type material of what parks we're going to use this year to use a different product. In these areas, which we're going to look at as what we'll call our test areas to see how they go. I know there's some different areas Steve and I had spoken about of trying some different methods. I know one of the methods I know Steve had talked about, I think there was a safety concern there of, I think safety to the individual using the method, which I think was the burn method, Steve, that you were talking about, which I could just see us going in a different route there with someone being hurt. I guess I just had the image of the human torch, the human flame, that we're going to go to the other side of safety. So I'm going to let Steve talk to you about some of the practices here that the Board of Commissioners had implemented years ago in the way of the field areas, and then also the move away from the Roundup in a number of these other areas that we're going to have, which actually be able to report back to you. And actually, if the Board of Health, working through Larry, actually, I think as we go through the months here, is actually maybe take one of your meetings out into the field and actually see the progress of what we have to see how it's being used. And with Steve's guys here, I know we have licensed applicators that put this product down. Maybe we can even have them too, also to see how this goes. So Steve, I'll let you take it from here.
Thank you, Bob. And Commissioner Nagel's right. This predates me, but the township has very much reduced its use of selective and non-selective herbicides over the years. So years back, I'll say maybe 8 years ago, we did used to use selective herbicides on our playing fields. That was all stopped. So basically today and in recent times, first off, the township does not use any selective or non-selective herbicides on any of its athletic playing fields. All the fields get is aerated, overseeded, and there's an organic fertilizer. That's it. There's no weed control on any of those fields. We do use the glyphosate 41, which is the brand name of the glyphosate. It is used very minimally. It's used about once a month in weed beds, in planting beds. So there's no mass spraying of anywhere. So, on various planting beds throughout the township, very specifically along the Radnor Trail and other parks, that's where it's used. We do not use it to denude any areas or anything like that. It's very specific. It's done with a hand sprayer. There's no spray arms or anything involved in that. This year, we've been looking at different products, and yes, the burning, the manager wasn't too thrilled with that. And then we just try to talk through things every winter to determine if there's something we can use. So I found this one product. The brand name is Avenger Weed Killer. It's basically citrus oil. The chemical name is D-limonene citrus oil, and we're going to give that a shot. Now, as with all these, we don't know the effectiveness of it. We do know the application rate is much greater, and there's a cost increase to use these. At this point, we're estimating probably 2 to 3 times what we spend currently. I won't know that till later in the week. We have some quotes coming in. So what we're proposing for this year, we obviously haven't started yet. I very much look forward to spring coming, is to use this alternative spray, this alternative item, and if it's not this, it'll be something of similar ilk, on the following parks as a test for 2015. So that would be the Radnor Trail, Beau Connor Park, Philippone Park, Clem McCrone Park, Emlenton L Park, and Sawmill Park. So those are the places we use it. And again, just to reiterate, we only use this in planting beds or in a parking lot, or against the curb, something like that. There is no mass spraying of whatever we use. And again, we've only used the glyphosate 41 for the past few years. And there are no other chemicals, just to make sure that is the only chemical the Public Works Department uses. And our folks are all certified by the state who do that.
I want to add one bit of information also. As you know, 2 or 3 years ago, the township no longer maintains the school district fields. We used to do that. However, when they were developing their spec, they requested and we provided to them the specifications about the organic treatment and no herbicides. And to the best of my knowledge, that was what was in their RFP. By the way, it's a lot longer than 8 years. Radnor was a real leader in this. It was a two-step process. First, we changed the chemicals we were using. I was on Parks Board at the time. I worked with the League of Women Voters Environmental Chair. We went up, talked to Penn State's turf management school, determined the chemicals that we were using were probably the worst you could use. And then 2 years after that, did another reevaluation. At that time, we did identify vendors who would do a complete organic program. Natural fertilizers, so they're complete, they're microbial, and we've only once or twice had to use pesticides where they might have had an outbreak of grubs or something of that nature, and even there, you try to use milky spore in small areas, but in large areas, that's prohibitive.
I thank you for your input. I think the most important thing for the community, of course, is obviously the safety of these chemicals, but the most important thing I think is openness and making sure that the public is confident in our looking at these things. And I thank you guys both for your attention to this and coming to the meeting, Mr. Norsini, and giving us this information. I really appreciate that.
If I could add one more thing. So again, in the past few years, we've tried to do this, and now we have weaned the township off. We don't purchase mulch anymore. We used to purchase mulch just like a homeowner would. So the trees that fall across the street and your Christmas trees over the years, they're all ground up. So the mulch you see at the township building and in the beds in the parks is actually the shredded trees back up. So there's no additives to that. There's no dye to any of that. It is completely natural. Whatever was in the tree is what goes back out in the beds.
Thank you again, both of you, for coming. But I have another question, if we're done that piece. I have not, because it just came out today as a blurb, and I don't know if you've had time to investigate. I have not. The new health concerns regarding turf field. Have you seen that on the news today? So will you be looking into that?
Yeah, I saw the article that came out about about the rubberized pellets that are within the fields and what that came out. I read the articles. We have not done any kind of research to that, but I did read the articles of what had come out. So that'll be something that we will start to take a look at.
Well, and will you get back to, obviously you'll get back to the commissioners, but let us know as well.
Oh, absolutely.
Because there was just a big, I guess, adding to the turf field. I saw at the commissioners meeting, or whatever, but we all could work together. We're a small town, and I think that's really important. Thank you.
Sure.
And I do understand also, Dr. Humphrey, at the last, maybe the thing is last year, we were speaking of the turf issue as well. I think he has some interest in that, and there was some articles last year about this as well. So I didn't get to read today's article, but I certainly will when I get home tonight. If there's any other new business, No other new business? Okay. So we'll move on to announcements, and I have a few, and if anybody has any of their own, please feel free to jump in at the end here. The health fair, of course, is this Wednesday, March 18th, in this room from 10 to 2, for anybody in the community who wants to attend that. That is Wednesday, right? On the right day? Okay, Wednesday. There's an interesting teleconference, if anybody has interest in the community, about the new HPV vaccine, which is also called HPV-9. It is an update to the current human papillomavirus vaccine. It is on April 1st at 12:15, and you can register at iep@paap.org, O-R-G. And Dr. Kestenbaum, a fellow at CHOP, will be giving a presentation about this new vaccine, which is hopefully will prevent more cervical cancer and also prevent human papillomavirus, which is also known as genital warts, a very good product for people between 11 and 23 years of age. Actually, it was approved down to 9 and 23 years of age. The third announcement was there is a mental health first aid course, again, for anybody in the community who would be interested. People who deal with adolescents or children, including teachers, coaches, community leaders, faith leaders, anybody who deals with children on a routine basis. There is a first aid course for mental health. It's 2 half days, Monday, March the 30th, and Tuesday, March the 31st. It's going to be given in Montgomery County in Norristown, but it teaches a 5-step action plan to deal with adolescent and child mental health crises, which would be a wonderful thing to know how to deal with if you're dealing with children on a routine basis. And my last announcement is that spring is here, and Radnor Township offers a lot of outdoor activities for your own health, so please get out and use our parks and be healthy. Any other announcements?
Yes, I have a few.
All right.
Mr. Kane, were you able to forward that mental health crisis to the principals so they could make it available to the teachers, et cetera?
I can do that. Youth Mental Health First Aid is a program that the state is really fostering. We actually have a trainer in the school district to train our own staff. So I would have to take a look and see if this is the same kind of training. It sounds like it's the similar training of which we have a trainer.
Okay, well, just so everyone's aware of what's out there, I think that's, again, we're such a small town that it's to be so isolated, whether it's, you know, the commissioners, the school district, or the Board of Health, it's best if we would work together. The other announcements I have, Wednesday, March 25th, Radnor High School at 7 o'clock. This is for parents, Narcotics Overdose Prevention and Education. It's called NOPE. And there will be a presentation in the day for the students, and then this is a presentation for the parents at 7 o'clock. So again, it's for mostly high school parents, but we're welcome to attend as well. So check that out. Mr. Kane said it's on the website, so you can check there. As some of you may remember, the Philadelphia College of Physicians sent us the form to write an abstract. They were looking for collaboration with public health and people. So Dr. Offit and I, Laura Offit and I collaborated and wrote a proposal, and we found out late Saturday night it was accepted. So we will, in fact, be presenting on April 6th at the Philadelphia College of Physicians representing Radnor and teens. So that's our big excitement. So thank you very much for getting that to us.
And do we have a public comment?
Yes, actually. It's actually in regards to old business. It's in regards to bringing the pets downtown to eat. It was just brought to my attention that in downtown Philadelphia, and I think there's an email that's been passed among you guys, that there are certain restaurants that actually feed the dogs. And what we don't want to happen is a he said, she said, and therefore we shut it down so that no one is allowed to bring pets, to restaurants. But I mean, it just, why are they allowed to do it and we aren't? You know, I mean, we're all governed by the same Department of Agriculture. You know, I mean, if they made the rules.
They are not allowed.
So they just haven't gotten caught?
What's typically happens is that they do this activity when the inspectors aren't around, but the activity is a violation of the ordinance, of the code.
Is it just something that's just kind of old, like the school year is devised around, you know, the farm schedule, the agricultural schedule? Is it kind of is that what this rule or this law is?
It's actually a part of the food code.
Please?
It's actually a part of the food code that only service animals are permitted. And not then if they create a condition that may be, in other words, if you have a person that's blind and they have a dog, and that dog starts to growl at other patrons,
That's a given.
then you can ask that dog to leave. You can ask them to tell them, remove the dog from the facility until they're done eating. But the service dog can't create a situation. It's not permitted in the state of Pennsylvania. The
But is
fact
it
that they do it means that they're breaking the law.
And we're certainly not asking you to turn your back on that because that's your job. But
I wouldn't.
And we're not asking you to. And we don't want, that's not what we're asking. But, you know, it's just, so there's nothing we can do is what you're saying. It's just, we're just out of luck.
Well, contacting the state to sort of change their laws or their codes would be the only way, because I think it is a top-down kind of thing. You know,
And
it's
it's
not
state by state.
correct. So it sounds like the gentleman who came last week, who was from Virginia, said that in Virginia that was going on. And I found it very interesting that there was restaurants actually advertising this on the web or on that advertisement as almost flagrantly breaking the code, which is interesting. But again, being that it's a top-down system and this community has to follow the rules of the state, the only way to go, it sounds like, is going through the state to try to make changes. And, you know, it seems as silly to us as it's sounding like it's sounding to you, but that's the rule, and that's what our hands are tied with that. And I think Larry made a good point.
And the other piece is, we are so small, and Philadelphia is just so big that they can't possibly have their own Mr. Taltone for every section to check out what's going on.
Right.
So
I just didn't know if that was in fact the case.
And Amy Leader was going to be looking into talking to her contacts at the Philadelphia Health Department to inquire, you know, is there anything that is not understood about this, or it's, you know, our assumption that they are truly, you know, violating the code, and it's just looking the other way.
And if you leave your name and email address, when we get that information from Dr. Leader, we'd be happy to send that on to you, because we would like community input and we would like to respond, because we feel that's our job.
Great.
Okay, thank you.
Okay, thanks.
Okay, any other announcements from anybody? Mr. Kane, anybody? Okay. I'll reiterate about this NOPE task force, simply because in the practice of medicine in the last 5 years, it's really incredible how unbelievably common it is now to see or hear about children, adolescents, teenagers getting into these narcotic medicines that are being prescribed a lot more often. And I feel this is a very important topic and something that we should continue as a board to talk about, because the community needs to be aware that there are prescription medications out there that are extraordinarily dangerous to teens, that seem like they might be fun for recreational use, but however lead to some very, very severe consequences, as serious as any injectable medications like heroin. So we have to be very aware of that. Any public participation or any other public participation today? Seeing that there's none, we will adjourn this meeting of the Board of Health and re-meet again on April 20th, 2015. I thank everyone for attending tonight. Thank you.